As the committee room's on mute, I hope the chair won't mind me jumping in, because I think I was going to be asking the next question. So I'll go ahead and do that, if that's okay. I'll start with, if I may, with you, Julie. One of the challenges I've seen in this space, and I've been doing a lot of work in the mental health arena since being elected and prior, is the impact that suicide and self-harm has, not just for the individual and the young person, but also their family as well. And it feels to me that one of the common threads of the statements just now has been the real need for support in the community, but also in the family and in schools. And I was just interested, from your perspective, what more can be done to help educate families and help support families through the process? Because what I'm hearing is that families are incredibly stressed and worried, and parents are incredibly worried during the process. They don't quite know what the next stage is. They don't know how to fight back, as it were, when there is a crisis happening, and they don't feel they're being listened to. Just interested in your view on that from your experience.
So I think the most important thing when we're dealing with young people's mental health problems, whether it be young people with thoughts of suicide, self-harm, is that they feel that they are able to talk about that and they're able to name it. And what we know is that one of the really difficult things, particularly around speaking about feelings of self-harm or suicide, is that they're very stigmatized and they're very misunderstood, and they scare people, particularly if young people start to talk about those feelings, and especially if they talk to them about their nearest and dearest. And so that actually makes young people not want to talk about those things often to their families, because they don't want to have that impact. We often, and in fact, I would like to move on at some point to be able to talk about the online environment, but what we often hear from young people is that they do look online for support because they don't feel that they can talk about these things to their families. So I would say one of the most important things is continuing to break down the stigma of talking about feelings of mental health challenge, suicide, self-harm, and equipping parents with the skills to know how to sensitively talk to their children about those issues and help them to navigate that and to not feel alone with those feelings, because it's tremendously scary feelings to be alone with. We do know from our Samaritans service that 1 in 12 calls to our helpline last year were around the issue of self-harm. So it is a really burgeoning issue. And I would say, picking up on Steve's point that he just made about the fact that there is now more permission to talk about mental health, and we are seeing young people talk more about it. I think what I would say is that's brilliant that young people are feeling more able to talk about it, but we need to not let them down, because actually if they come and say, I've got a problem, I'm in trouble, but what they're then finding is they're being buffeted around from pillar to post, or being given the message that their issues aren't serious enough yet, then actually what we're going to see is young people feeling like they have to have escalated to a point of real crisis before they have permission for help. So I think that we need to, as I said before, combine really bringing in much more help, much sooner, and supporting parents with how to have those really difficult conversations. But it is, as colleagues have already said, it's not just about any one place where this is the answer to this. The answer to this is in our society and in our communities. So actually, some of the major sources of support for young people around mental health are actually, for example, where local authorities fund. It's in youth services. Of course, we've seen youth services decimated. It's in those community spaces where young people are known by others, not just their families, but also it's those community spaces where families can get support as well. So we need much more investment at a community level and much earlier.
Thank you. And if I may address a similar point in one of the comments you just made, then Julie, to Mark, from a prevention perspective, one of the things I hear is parents who are worried that their child has to go to almost the extreme level of self-harm or worse before they really get the support that's needed, before they're listened to. And my concern is for the child, but also for the families. And again, just that point around, would it help if there were clearer pathways and clearer opportunities for parents to be able to flag concerns without it getting to the point of self-harm having actually been happening for their child?
Yeah, I mean, I think it's really clear that every step we can take preventative action and I think that's why we're calling for this really ugly term, but I think it's important in terms of proportionate universalism, which is in order for stigma and for early intervention problems to be prevented, you need mental health literacy. We need to understand our inner worlds much more effectively, our emotions, what triggers them. This is stuff we weren't taught at school, and I think it needs to be part of what we educate children and also parents. And I think one of the things that Wales and Scotland are introducing is an independent counsellor in schools, so that there is that reference point for that more pastoral care and the training of teachers to be able to have these conversations, because we're not going to solve this by a clinical response it's not going to be specialist support. All of us have to be involved in understanding our own mental health and how we share that with others. I just think there is, to Julie's point, there is this real paradox that we're building new hospitals. We've got waiting lists on CAMHS, and at the same time, YMCA have closed 750 youth centres. So if we are taking away the things that kids need to be amongst others, to learn social skills, to get that support, and then we can't be surprised when we're seeing increasing rates now, rising in terms of children's mental health. And in our own study, and I'll finish with this, but in our own study, we've been tracking mental health of the population, and we see thoughts of suicides at almost double the rates of the adult population in our young people, rates of loneliness, rates of hopelessness. So the flashing red lights are there, that this is a situation that needs attending to.
Thank you. And very finally, if I may, just briefly, because I'm conscious of other colleagues coming in, to Professor Appleby, just from your professional experience and your academic experience, at what point are children actually raising concerns to their families and friends? Is it right at the start of starting to get signs of depression or concern, or is it when it's almost too late and they're starting to self-harm?
Well, I don't think there's a single pattern. There's quite a bit of variation in how readily people talk about their mental health within their families. Some prefer to talk to peers. There's quite a large group of young people who go on to die by suicide, who have never really expressed any warning sign in a conventional sense. And this is exceptionally distressing to families, because from their point of view, they see the suicide as having happened out of the blue, and they very often use that phrase. And when you look back over the history of what happened, there were some signs in some cases, but in others, it looks as if either the young person kept their distress to themselves, or they spoke to somebody else who wasn't in a position to support them, or perhaps, and this is a particular worry, for some young people, their emotions are quite, I suppose, volatile, brittle. And so it's the process from feeling unhappy to feeling despair may be quite a rapid one, so that the potential for intervention, that gap where something might be done, is reduced. So I don't think we have a very good system at the moment for allowing people to seek help, but crisis services, the availability of crisis services when people get into crisis, is vital for that. Young people being aware of their own mental health, and people have mentioned this already, but we can't simply rely on services to pick up the suicide problem. The prevention starts much earlier than that, when young people recognise the difficulties that they themselves are getting into. So there's a need for an early intervention, which depends on young people themselves to an extent.
Thank you very much. Back to you, Chair.